This is New York Nightly News with Chuck Scarborough, live on New York Nonstop.
Thank you very much. And joining us now to talk about the pros and cons of proposed health care reform is Dr. Svetlana Kogan. She is a member of the American Medical Association. I believe the AMA has actually backed the president's plan. But you have some questions about it.
That's correct, Chuck. I'm here to represent doctors in private practice. Unfortunately, many of us, there is no uniform opinion. Many of us are hospital employees. Some of us are in large practices, partially subsidized by the hospitals. I'm a private physician. I went into solo practice because I love individualizing, customizing patient care. I know my patients by name, and I don't want to lose touch with my patients.
Is that what you think the president's plan would do, would make you lose touch with your patients, would not allow you to individualize your care anymore?
Yes, I have a lot of philosophical objections here. And one of them comes from the fact that, in the past attempts for the government intervention into the health plan, the patient care has been compromised, and Medicare and Medicaid's declining reimbursements in opposition to the overhead of the doctor's practices going up are a good example of that. In addition, when we look at the plan, look at what's being proposed. The universal health care with mandatory participation from physicians who are accepting Medicare at the moment. Where's my freedom of choice? As a patient, I will not have any out-of-network benefits. So if I don't like, let's say, the way my doctor is taking care of me, I don't have a choice to go and see another physician. I will not be covered for that. So it's like not having a health care coverage at all. For a family with 2 kids, a husband and a wife with a $40,000 income, the government is proposing a subsidized plan that will cost them $1,700 a month. And they're saying that this is as opposed to the $12,000 coverage that exists in place at the moment. Well, my question is, if between the entire milieu that the patients are exposed to, doctor's office, laboratory tests, hospital, developmental programs for the children, we're dealing with 2 adults and 2 kids here. $1,700 is what's going to be the expense spent on this family. If that's the case, all of us are going to face the bankruptcy. One might say, Dr. Kogan, you misunderstand the picture. This is only a part of what's going to be contributed towards this family. The rest will be covered by the government. Where is this coming from? Our pockets, our taxes.
I know I'm going to ask you to oversimplify this, but if you don't like the plan that's being proposed right now,
correct,
and I'm not misquoting you to say that you do think reform has to be made in some way, that the current system isn't.
Absolutely, we're in trouble as we are.
What do you think the best avenue would be to try to get the best health care with most flexibility at the least cost for Americans?
I think the very first thing that should be done is a tort reform. The malpractice payouts should be cut. Absolutely.
It's not on the president's agenda right now.
Unfortunately, it's not. And we physicians have been trying to get this through for decades. Broward County, Florida, gynecologists are paying $208,000 malpractice insurance annually. How many females do we have to see not to face the bankruptcy in this predicament?
What percentage of your cost is eaten up by your malpractice insurance premium right now?
Let me put it this way, Chuck. If I were to rely exclusively on the insurance payments, and I have one of them with me, it's a $9 payment for a visit. I'm not going to disclose which insurance company.
Your premiums.
That's right. So if if I were to rely on my malpractice insurance premiums,
how much could you reduce your price if you didn't have to pay this malpractice
tremendously.
premium?
In Texas, an internist is facing a $2,000 malpractice premium per year, while I, in New York, have to pay a $25,000 claims only per year. So it's quite a difference. So this would definitely be one of the venues to start with. In addition, I would definitely force the insurances accept people with pre-existing conditions. Cover for preventive care. Diabetic and cholesterol situation is terrible. We have a 30% obesity.
You think there's a private solution? The government doesn't have to do it.
It's like a bad marriage. If we have a bad husband or a wife, do we immediately turn around and go and start seeing somebody else? No, we go to a family counseling, we try to work things out. And this is what I think we should do. We used to have the best medicine in the world. People are still flocking from all over the world to partake of our medicine. Let's work with what we have.
All right, Dr. Kogan, thanks for coming in and sharing your thoughts with us.
My pleasure.
We appreciate it.